The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You are watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is an expert on the topic, board-certified plastic surgeon, Dr. Javaheri. Dr. Javaheri, welcome to the program.
Hi, Randy. How are you doing?
Good, good. Now, before we get into today's topic, I mean, you have impressive credentials, obviously. I guess you're board-certified in otolaryngology,
yes,
and also plastic surgery.
Yes.
Let's begin with the Moss Clinic. I've had Dr. Moss on the program before. What is your role there?
My role in the clinic is a specialist in breast and body.
Okay.
So I see a lot of patients who specifically want either breast procedures or even more common than anything else is liposuction of the parts of their body.
Okay, now the art and science of it, because it seems, I say this respectfully, seems pretty straightforward, liposuction. Is there art to it? I mean, isn't it?
Well, like anything, there's an art to it. You know, anybody can really become a master technician, possibly, but an art is a gift. Not everybody is born an artist.
So is liposuction, you know, the most popular of all the cosmetic procedures?
Absolutely. Outside of Botox, liposuction is the most popular procedure.
Why do you think it is?
It's safe, it's predictable, it can be done even as an outpatient setting. One can come in even at a lunchtime.
Lunchtime lipo. You
right.
call it lunchtime lipo.
Yes.
I've never heard that before.
Well, lunchtime liposuction refers to a procedure where a person comes in literally even at a lunchtime, have a procedure that's very safe, essentially painless procedure, can be done in less than an hour, have their procedure, even go to work the same day if you want.
Is that right? So like abdomen, for example?
Limited areas, of course, Randy.
So abdomen and...
abdomen, lower part of abdomen, that pooch that sometimes shows in people's dresses and gowns, the hips areas, the side areas, absolutely. That can
Did you coin that phrase, by the way, lunchtime
No,
lipo?
I wish I had, but
okay,
no, I have not.
But it's popular there.
Very popular. It's becoming more and more popular nowadays, yes.
So the downtime is very low.
Downtime is
People
very
were
low.
tucking your clothes, things like that. People
Absolutely.
don't know you had it.
Quick recovery and minimal discomfort. Patients, in fact, you can do the procedures in which patient has essentially no pain at all.
What about tough economy? I mean, are people still doing these things? And what's your message to somebody?
Well, for one thing,
in the job market,
yes,
things like that.
yes, they can do it. It comes back to the image again, Randy. You know, in a tough economy, people may need that extra boost in their image. Perhaps they're a little bit older. Perhaps their physique is not quite where they want to be. They want to compete with the younger people. They have the experience, but they want to improve their shape.
And something, I'm going to tell you something else that you said in the pre-production meeting, is you said that more attractive people, fitter looking people are more successful.
Yes.
They have the better jobs. You believe that?
Absolutely. If you look at, I don't think it's a coincidence to see that the most successful people tend to be, though not absolutely, tend to be better looking, tend to be better fit. I think, I'm not saying that it's wrong to be unfit, but I think it's better. You have a better quality of life. You look at life differently.
Is that right?
Absolutely. I live it myself. You know, I believe
You're a
in
marathoner,
health.
aren't you?
I run marathons. I've run many marathons. I do triathlons, and I've learned by doing that. I learned that I see the world quite differently. I see that it gives me a lot more self-confidence, the confidence that I can do something.
Like when you walk into a room, you're in shape, you feel great.
I feel very good, and I am not afraid to tell people that go out and exercise, but if you can't get rid of those particular areas, liposuction will take care of it for you. And I have it myself. I have some areas, little areas that I can't get rid of. I'm ready to go under the knife myself.
Now, do you have to, you can't lipo yourself, right?
No, I can't. I wish I could, because I know I can get a good result.
Or else you would do it for sure. Okay. Now, do you have to be, do you consider yourself a perfectionist? Dr. Moss thinks you are.
I think you have to be. I think in my field you have to be a perfectionist. If you're not doing the best job.
So people, do they, they get the lipo, they start eating better?
Yes.
So it doesn't come back?
Absolutely. You know, Randy, it's an investment in yourself. Okay, you're doing a procedure to enhance your body just a little bit better. That gives you so much self-confidence. Going out in a swimming pool, the right bikini, the right swimsuit, you look better. You feel better.
Do they tell you these things, by the way, on the consult? They come back and say, oh, now I'm doing this, now I'm doing that?
Absolutely. I have people that come and tell me that, you know, doctor, before I came here, I had this little area that I've been thinking about it for so long. I tried everything to get rid of it, and I couldn't. But now that operation I had, it was painless. I feel really good about myself. I feel like I can do anything now.
Really?
Absolutely.
Sounds like a bit of an exaggeration. So they will say these kind of things. I mean, it's all done. Now, what do they say? Is it emotional when they look at themselves for the first time? They take the wraps off or whatever?
I have patients who literally cried.
Really?
They have tears saying, thank you, doctor, for doing this. I don't think I'm unique. I think there are a lot of other plastic surgeons that can come and tell you they've experienced the same things. Image is so important. It's such an important part of life. I'm not saying that image in a sense that it's something to look at yourself in a very selfish way, but image because it helps a person's self-esteem. People look at you differently because you are fit. It gives them the impression that you are somebody who likes to take care of themselves, a person who, because of that, you're more serious about your work. You're able to go out after anything you want, project or whatever it is, with self-confidence.
Now, your center, by the way, because you're, I mean, one of the rare comprehensive centers.
I think it's
facial
the only,
plastic, board-certified plastic.
Yes, the only center in the Bay Area that I know of that we have specialists only in the particular areas. Like my associate, Dr. Moss, is a specialist and world-renowned in the facial plastic world, in head and neck surgery, in a facial plastic surgery. And myself, I joined Dr. Moss a couple of months ago to specialize only in the breast and body.
Let's take a look at some of these photos.
Sure, let me show you the photo over here, for example. This can be done as an outpatient setting. If you look at it, Randy, this young lady came to me with just an extra tissue in the extra fat in the abdomen and the side areas.
Pretty good shaped person, though.
Yes, but you know, she had these areas that really bothered her. She was, in fact, she was somebody who exercises routinely, but she just could not get rid of these areas.
So what areas? Just what? A little bit of the love handle area?
She had areas in the love handle areas in the lower abdomen and the medial thighs, and this was done in a...
Medial thighs is what? Inner thigh?
Inner thighs.
Inner thigh?
That's right, upper inner thighs. And this was done in an outpatient setting and was removed, and she's happy as a camper.
Okay, let's take a look right there.
Yes, we can look at over here. The lower abdomen, she had a very even result.
It's subtle when you put them side by side, but she looks like a smaller person.
She was extremely happy. In fact, I can show you on her back. I took a photo of her back as well. So if you see, Randy, the love handle areas in the back, the hip area, love handle, so-called love handle areas back here, and even some of her sides, this was done...
well, she has more of a shape now.
She has a lot more of a shape. And if you even look at her medial thighs, it's just a subtle difference, but is enough, and enough to make her life much better.
Is this definitely more women than men that do this?
Overall, more women do, but I've been getting a lot more men in the last 2 to 3 years.
Are the patients getting younger and younger, or older and older?
I'm getting all, essentially fairly all ages, you know, but I think men are becoming more confident in themselves. Men are becoming more confident and more content with plastic surgery. I think they're realizing that plastic surgery is not only for women.
It's become mainstream.
Becoming more and more mainstream.
Is it part of aging gracefully, by the way, in your opinion?
I think people are beginning to realize, you know, the more society advances, progresses socially and economically, the more we tend to look at ourselves and see, hey, actually, why not look better? We are more wealthy as a country. Why not look better why not look better in this society? Contribute more to this society.
So you get fit, like very fit people that just have little problem areas.
Yes.
What about the overweight patient?
Well, people who are overweight, they may require two different procedures. Sometimes they may require a large volume liposuction. In that case, it really won't be lunchtime. They would have to have under general anesthesia.
Okay.
What I mean by large volume, of course, Randy, we want to keep it under a certain amount for safety reasons, of course. And other people who have extra skin, they may require abdominoplasty or the tummy tuck or even a lower body lift.
So the bigger patients, you can work with the bigger patients?
Yes, you know, I have to evaluate them first, of course, and whether to see if they're good candidates for liposuction. If they are, then we can do them.
Okay, what's the most popular area of the body?
The most popular area by far is the lower tummy area and the love handles, and then followed by the medial thighs, even the arms too.
Okay, now and we'll start with the abdomen. Okay,
yes.
So what is your technique? What are you doing? What's new also in liposuction?
Well, what's new nowadays and becoming more and more popular, it was what's called a laser liposuction. Now, but laser liposuction is still what may offer is it may offer more contraction of the tissue and may improve with cellulite.
So with a woman, she comes in maybe after pregnancy,
Yes.
she's got a little pouch right there, maybe a little love handle. Is that a lunchtime? Is that something?
Absolutely.
Lunchtime lipo?
You know, what I do, that woman that comes in, we can offer her essentially a painless procedure, what's called a tumescent liposuction technique, where we infiltrate fluid with local anesthetic. In those particular areas, we can do it in under an hour. They can go back to work if they wanted, go back to doing whatever they need to do, even that afternoon.
So work that afternoon. Okay, now what about a
Absolutely.
smooth results? You say, I mean, you're big on that smooth look.
Yes, you know.
How is that achieved?
It's achieved essentially really by your experience. You know, that's part of the art of plastic surgery. You know, anybody can remove fat, but what the real artist is to remove enough fat to give that smooth appearance. If you remove too much, Randy, no matter what technique you use, you're going to get a lumpy, bumpy result, which
So
is
it's
not
tedious.
It's
You
tedious.
spend a lot of time doing it.
That's why you have to be a professional to be liposuction,
Now with all the areas,
to be a plastic surgeon.
as a board certified plastic surgeon, is this the happiest group of patients, in your opinion, the liposuction patients?
Absolutely. These people are very, very happy. If you do the job right, people are so happy, and they'll refer other patients to you.
Now what about guys with, you know, maybe they're pretty good shape, but they want maybe a little bit more of a chiseled look? Can you give them some kind of a six-pack look?
Absolutely. That can be done. If that's what the patient desired, we can give them that look. Again, these people usually are people who regularly exercise, they're runners or whatever exercise they do, but because of their genes, they just can't get rid of these particular areas. Liposuction really improves those.
How many dress sizes have you heard somebody losing after the procedure?
Well, of course, lunchtime liposuction, you know, Randy, is different than a full liposuction. I've had patients lose up to 4 dress sizes.
What about men with their jeans or waists?
Oh, men, even men. I've had men lose. I had, in fact, just recently had a man whose waist size was 42, went down to 38.
Down to a 38.
Yes.
So somebody really with a 34, 36, somewhere in there could probably get down to about a 32. I mean, with the right canvas.
One or two dress size, one or two waist sizes or dress sizes is not unusual.
So lunchtime lipo, I mean, is that what do they ever call now? And
It's
say,
becoming more of a popular term, Randy. Lunchtime liposuction to show that it can be done in a short time with quick recovery and minimal to no pain.
Okay, I know you have more photos. What are the misconceptions about liposuction? Maybe that you hear that just aren't true.
You know, it's a safe procedure. People sometimes have misgivings about having anesthesia or pain or even lumps and bumps. I think if you have a state-of-the-art facility, if you have the right anesthesiologist working, if you have that artistic gift, these things are not a problem.
So there's
at
art
all.
to lipo.
Absolutely.
Really. It's not just straightforward going in, sucking out the fat.
You know, as I said before, Randy, anybody can become a master technician, but art, there's an art to medicine, especially in plastic surgery. There's no other field in medicine that uses art to the benefit. And you can see for yourself, a patient comes in with an area that, for example, is larger or smaller or whatever that case may be, and afterward they're done very happy. You've gotten rid of that. That is art. It's almost like sculpturing somebody.
And you say they start exercising more.
They have
eat better.
Absolutely. They have more self-confidence. They can do some of those things that perhaps before they had a fear or they just did not want to do.
How well do the thighs treat? And do you go all the way around?
Oh, you can go all the way around the thighs, and you know, Randy, doing the thighs or even the abdomen is a difference in going from a very tight dress or pants that's going to show the areas where you don't want to show. Liposuction can remove those areas. You can have a snug dress or snug pants, but feeling confident, feeling great, and looking up.
Do they feel younger? Do you ever hear that? I know with facelifting, things like that, but I mean, with lipo, do they feel younger?
People can feel younger, but better than that, you know, people feel more fit. They feel that they are in control of their body. And that's one of the things that's so powerful about liposuction and plastic surgery.
Now we're going to take a quick break. A couple more photos before the break. What are we looking at over here?
We're looking here is what's called a male breast. You know, these people come to you, sometimes they don't remove their shirts. They don't like to show themselves, and that's the problem. They've had their whole life.
Is that rare, by the way?
It's not rare at all. You know, sometimes you just don't know because people wear shirts, loose-fitting shirts, so they don't show it. Sometimes people don't even know they can have this procedure to improve their look.
So they don't take off their shirts. What do they tell you in the consult, by the way? Guy goes in.
When they come to see me, they tell me, you know, doctor, I've had this problem all my life. I didn't like to remove my shirt in gym when I was growing up in their adolescent years, in junior high school. People made fun of them when they did, absolutely, or they don't like to go in the swimming pool or at the beach. And that's some of the common things that I hear about this.
Is that
procedure.
a tricky area, by the way? Because I've also been told.
It is tricky. If it's not done properly, it can be very lumpy and bumpy appearance or extremely uneven, yes.
So your technique, okay, so with this gentleman.
Yes.
When you see it, what are you thinking?
Well, when I look at it, first you have to look to see whether they have a lot of extra skin. Of course, a lot of the skin can contract with liposuction, but one of the things I do is minimal amount of incisions. I know there may be people out there that may want to do several incisions, but I want to hide the incisions in areas that they can't see, and at the same time give them the self-confidence after they've done the procedure as if they haven't had anything done at all. They can go out there without their shirts and look great.
So this before and after, same person?
Yes. Now here's a big difference in this person's life. You know, he can go out there and impress the young ladies or go out to the swimming pool or the beach without any worries at all. And this is a person from before. You can see that he actually had a fairly large sized breast to one procedure that was outpatient procedure, left without a problem.
So after, you know, when it's all done, do they come back? Are they wearing like a golf shirt or tight shirt?
They are happy to remove their shirt right in front of you. They're proud to show themselves. They're so happy about these, absolutely.
So people, I mean, with lipo in general, I mean, do you see, even on the second, you know, when they come in, you know, for a checkup, I guess, after the procedure, they're noticeably dressing differently than they did on the consult?
Yes. When they come to see you after they've done initial healing, they come with confidence. They come there with their heads up high, their neck straight, great posture, not even trying. You can even tell. In fact, we have our people, our employees. One of the first things they notice when they come in and say, you know, Mrs. Such and Such, or Miss Such and Such, or Mr. Such and Such, they came in before. They didn't look very happy. They looked like they didn't have confidence. Now they come in with much more confidence.
Okay, we're going to take a quick break. We come back, more photos. You have women, a lot more things. Also buttocks. You could do buttocks as well?
Yes, I do buttock augmentation with fat transfer, so we can liposuction them at the same time, place their own fat into their buttock, give them a great shape. People who have the flat buttock appearance and they want to have more of a protrusion, you know, it's more common. So
you do a lot of that. What do they call that? A buttock lift or something? Or augmentation?
We call it a buttock augmentation or enhancement, gluteal, whatever the terminology is. It's really giving them the better appearance in their buttock.
So you do it?
Absolutely, I do.
Is that right?
And it has to be done. You know, it's very technique specific. Not everybody can really do a good job, Randy.
All right. Okay, we're going to take a quick break. We come back, more photos. You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. What you need to know about liposuction up next. We'll be right back.
Tried all sorts of cover-ups for bad breath? Try the science of BreatherX. Only BreatherX has Zytex. It attacks the cause of bad breath, keeps working for hours. It's clinically proven for real fresh breath.
Get non-prescription BreatherX from your dental hygienist and now at fine stores everywhere.
There's a new secret to looking younger. An advancement so profound, it took a team of scientists years to create. A time machine called Zoom. Getting zoomed is the fastest way to erase years from your looks. Zoom is the most advanced teeth whitening ever. Only your dentist has it. Nothing works like it. Zoom Gel gently penetrates the submicron pores of tooth enamel. The patented Zoom Light superactivates the gel through a unique photofenton reaction, breaking down the stain's double bonds. In just 45 minutes, years of discoloration disappear, transforming your smile to wow. To find a Zoom dentist near you, go to zoomnow.com or call 800-891-4895. For your whitest, most confident, most irresistible smile, get zoomed today. Make your appointment at zoomnow.com or call 800-891-4895 today and discover the wow of Zoom.
You're watching the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Hot topic, what you need to know about liposuction. With us, we have an expert on the topic, board-certified plastic surgeon, Dr. Javaheri, and the go-to guy in San Francisco for liposuction.
Yes, thank you.
You like doing it, which I think is interesting because doctors always say, I hate liposuction.
Yes.
I hate doing it. Do you think that makes you better?
Well, you know, people don't like doing it because it's tiring.
Do you hear that too, by the way? It's not just me. I hear this from
I hear
doctors.
it all the time. And it can be pretty taxing, but you know, if you're a perfectionist, if you like what you want to do, if you want to make people happy, empower their lives, improve their self-appearance, self-image, liposuction is a great procedure.
Okay, so the buttocks.
Yes.
I've heard from some people that you don't want to touch that area. Some people say you can. What are your thoughts and what's your feeling about lipo on buttocks?
Oh, well, we don't do the liposuction on the buttock itself, but what I do is enhance, I'll augment the buttock, make it larger, give that better buttock appearance.
But don't they want a smaller buttocks?
No, people want to have, well,
some people, I guess
it's not just a smaller buttock, Randy. You want to shape it. It isn't just having a smaller or bigger buttock. You want to shape it, and that's what it's about.
So you like maybe narrow the sides and then give it more of a shape?
You want to give it more of a round shape, bring it out a little bit. You don't have to make an extremely large buttock. That's not the point. The point is to shape it. Do you have a better shape? You know, we were talking about it earlier. Image is so important. Buttock is just part of it. You know, if you look at history, in the history of art, you know, I like art, Randy, not just, I don't just consider myself an artist in this area. But if you look at history, the two or three areas in the body that has been reproduced so much in art and sculpture has been the face, breast, and the body. And in the body, the buttock is an extremely important. Look at all the Renaissance photos. It really highlights the buttock areas.
Augmentation?
Yes, and shaping. Buttock reshaping and augmentation, yes.
And who's getting this done, by the way? Men and women?
Both, men and women. I have both patients, men and women, mostly women, but I think I have had men patients, and I think men are usually very shy about cosmetic surgery.
These are great photos, by the way, and I don't know if we can show these on broadcast television, but what are we looking at here? This is one of them. Yes,
we're looking at women who had, they came in specifically to have their buttock augmented. They had something about that been worried.
Just felt like they had a flat
buttock, and it's been something that was been worried. They've been thinking about it for all their lives or many years, and they wanted to have an improvement. What we do is we remove fat from their own body, so they have a liposuction or liposculpture at the same time, but that fat, if it's done properly, of course, you know, it's very technique dependent.
Okay.
It's done in extremely 2 or 3 small incisions. They can have the shape of their lives.
Okay, now other photos. What else are we looking at? Yes. We're just about out of time.
Okay, here's another picture. I wanted you asked about men, and if you see the on the top photo, we have a man who came to see me for just that particular procedure. They wanted to have better shape in the abdomen, and they didn't even ask about this. I asked them, look, your buttock is a little bit misshaped. Do you want to improve this? Once I said that, you know, the first thing I said, you know, doctor, I've been thinking about this myself.
Is that right?
Absolutely, and I'm glad you brought it up. Can you do something about it? When I told them, you know, you can use your own fat and augment that, reshape it, they were more than happy, and here you can see the result yourself. They have a improved shape in their abdomen and their buttock. You know, this person is a young man in his mid to late 30s. He came to see me for this, and now he has so much confidence. He has no fear about undressing in front of others or going to the beach.
So what I mean, is he? So just looks better in pants.
Looks better in pants.
Or shorts or whatever?
Or shorts, whatever, absolutely. Do we have time for another photo?
Okay, here we go.
Sure, Randy, here's another photo of a man who came to see me, a man who wanted liposuction of his abdomen, and also he had an issue with his breasts, and that was done, again, as an outpatient setting, operation.
Huge difference.
Less than 2 hours to do the procedure, was a very quick recovery, was back at work within just 3 or 4 days. But you see now the difference is this young man, he can go out with a tight shirt to strut his stuff, let's say. To go out to the gym. When he goes out to the gym working out, He has no fear of showing himself, whether it's going to the beach, showing what he has to basically to show, hey, I'm confident in myself.
And fit. Okay, so the older patients, let's say, what are the older females? At what age range, I mean the older age range do you see that are coming in for lipo?
I've had patients up to age 58 or 60. You know, after a certain age, you have to be careful what you do, how much you do.
Arms. And we're out of time, but, we haven't mentioned it. How well do they treat?
Oh, arms can be treated very well, Randy. We have women who just don't want to get into particular dresses. They don't want to go out showing.
Yeah, women have to show their arms.
Absolutely, arms. As you know, arms are as an area of the body that it shows a woman's youth, a woman's fit appearance, and this is an area that can be treated very well, very easily.
Can they bounce back though? I mean, if you remove.
If you remove the fat, they maintain their shape, their healthy lifestyle, no, it won't come back.
Early treatment is better?
Early treatment is always better. That means you don't have to worry about the extra skin, so they don't have to have that surgical appearance. You can have a small incision, get rid of the
So it
fat.
doesn't come back, obviously. So if you do it early, theoretically, you can't have fat arms?
If you maintain a healthy lifestyle, Randy, you won't get those back. You know, we're born with a certain number of fat cells. After a certain age, we're never going to get those, we're not going to have more fat cells. So if you remove those fat cells, you won't have any more.
Okay, now if somebody's fit, they're fit of their whole body and their arms, back question about the arms, and they just have, could you almost chisel out a tricep if it's a lean person?
Oh, absolutely. The tricep is really the area we want to focus on when we do arms. The bicep areas is more complicated because of nerves and so on, so you don't really want to go into those areas. But the tricep areas, that can be chiseled to look just great.
So knees. I mean, you could even do knees.
You can do knees. Randy, you know, knees is one of those areas that's a little bit tricky, but especially women who don't want to show their knees, you know, they're
really?
wearing,
Did they tell you that?
Oh yes, absolutely. They wear dresses over their knees because they have this fear. They don't like to show their knees. They're self-conscious about it. That's an area that can be done at a so-called lunchtime liposuction, Randy. You know, we
so if they're doing a lunchtime lipo, okay,
yes.
so they're just getting they're not put to sleep completely.
No, in fact they're completely awake. It's
painful.
Not at all. We've had patients tell us this didn't even hurt at all. In fact, we have patients telling us the root canal was a lot more painful. The going to the dentist, getting their teeth cleaned was more painful than having a lunch.
So somebody with a little bit of pooch, they're watching this.
Yes.
Tomorrow they could go to lunch, if they could get on the schedule.
Absolutely.
And then go back to work.
Go back to work
with a flat
in the afternoon, easily.
All right. Okay, I want to final message. Somebody has a part of their body they don't like, the liposuction can take care of, but for whatever reason they're putting it off. What do you say to them?
Don't hesitate. You have a healthy lifestyle, and the liposuction can be done in a very safe way, in a very painless way, and very fast recovery.
I want to thank you for coming on the show. Very good.
Thank you, Randy, for having me.
You've been watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to point a friend in the direction of this interview, or if you want to see it again, you can visit our website, just put in liposuction, and review the show. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.